Welcome to the deep dive. Today, we're going to grapple with something pretty challenging, a real paradox.
Hmm.
How can the country spending the most on healthcare, I mean, way more than anyone else, also have some of the, well, poorest health outcomes?
That's a huge question.
Yeah, we're looking at a system where, despite all this money pouring in, millions of people are still drowning in medical debt, or they can't even get basic care.
That's the reality for many.
So our deep dive today, it's all about the U.S. healthcare system, and we're really exploring why some folks are calling it, and this is quite a statement, a global outlier or institutionalized scam.
Strong words.
Definitely. And we're basing this conversation on a pretty detailed report. It's called The American Healthcare Paradox, Costliest, Poorest Outcomes, and it just came out June 2025.
Right, a recent analysis.
So our mission really is to unpack why. What are the structural things, the economic reasons, the politics behind this paradox?
Trying to figure out who's really working for.
Exactly. Does it benefit the public? Or is it mostly serving, these big private interests that are kind of dug in?
Let's get into it.
Okay, let's unpack this. I mean, how did we even get here? Spending so much, but people aren't necessarily getting healthier.
Well, that's the core paradox the report tackles head on. The U.S. system is, the most expensive. By a lot.
Mm-hmm.
But when you look at the actual results, the health indicators, it consistently lags behind other wealthy nations.
Okay, like what kind of numbers are we talking about?
So get this, for 2024, the U.S. spent around $4.5 trillion on healthcare.
Annually.
Trillion.
Yeah.
Wow.
And per person, that works out to roughly $13,000.
$13,000 per person.
Right. Now look at places like the UK, Canada, Australia. They're more in the ballpark of, say, $5,000 to $6,000 per person.
So less than half.
Often, yeah. But here's the kicker. Despite spending all that extra money, U.S. life expectancy, it's hovering around 77 years.
77. In those other countries.
They're typically seeing 81 to 83 years. So we're paying double, getting fewer years of life on average.
That's the stark reality. And it's not just life expectancy. The report points to other areas, too, like infant mortality rates, outcomes for diseases you can prevent. We're underperforming there as well.
So we're spending double, sometimes almost triple what other developed nations are, but our people are living shorter lives and facing more preventable diseases. That really highlights the paradox, doesn't it?
It absolutely does. It's not just abstract numbers. It's about real lives, quality of life.
So how does the system even work? Or maybe how doesn't it work?
Right. So the report breaks down the structure. It's what you'd call a mixed system.
Mixed out.
Well, you've got public programs like Medicare for seniors, Medicaid for lower-income folks, the VA for veterans, government-funded coverage for specific groups.
Okay.
But alongside that, you have this really dominant private sector. Most working-age adults, they get their insurance through their job, employer-sponsored.
Right, that's the most common way, I think.
It is. And even with the Affordable Care Act, the ACA, which did expand coverage.
Yeah, that was supposed to help, right?
It did reduce the number of uninsured, but there are still somewhere around 25 to 30 million Americans completely without insurance.
Still that many. Wow.
It's a persistent gap.
Okay, here's where it gets really interesting, or maybe concerning. The report uses that phrase, legalized scam. It's pretty blunt.
It is blunt.
So let's dive into why they'd say that. What are the specific failures they're pointing to?
Okay. The report lays out a few key reasons for using such strong language. First up is this idea of profit over patients.
Meaning?
Well, the system is dominated by for-profit insurance companies and, increasingly, for-profit hospital chains. Their primary legal duty, often, is to their shareholders, not necessarily to patient outcomes.
So the bottom line comes first.
It can certainly incentivize things that boost the bottom line, like maybe ordering more tests or procedures than strictly needed. That's incentivized overtreatment, or upcoding billing for a more complex, expensive service than what was actually provided.
That's common.
It's a known issue in the industry.
Yeah.
And then, of course, there's the whole issue of denying claims. Insurers save money when they don't pay out.
Right, forcing patients or doctors to appeal and fight for it.
Exactly. It creates friction and barriers to care.
That feels like a fundamental conflict of interest, almost.
That's certainly how the report frames it. And tied into that is the issue with big pharma, drug pricing.
Ah, yes. Always a hot topic. What's the report say there?
It highlights the, well, pretty much unchecked pricing power pharmaceutical companies have in the U.S.
Unlike other countries.
Right. In places like the UK or Canada, the government negotiates drug prices nationally. They use their bulk purchasing power to get lower rates.
We don't do that here, not really.
Not broadly, no. The government is actually forbidden by law from negotiating prices for Medicare Part D, for example, though the Inflation Reduction Act made some very limited exceptions recently. But system-wide, no.
So companies can charge whatever the market will bear.
Essentially, the report uses the classic example, insulin.
Right.
Costs maybe, what, $6 to manufacture a vial.
Something like that, yeah.
But it can retail for $300, $350, sometimes more in the U.S.
Well, in Canada or Europe?
It's a tiny fraction of that cost.
Yeah.
Because their systems negotiate.
That one example just seems indefensible, especially for something people need to live.
It's a stark illustration of the pricing power issue. Then there's another huge factor the report calls out, administrative bloat.
Bloat, meaning paperwork, bureaucracy.
Exactly. Just the sheer complexity of running the U.S. system. The report estimates that something like 25% of all U.S. healthcare spending goes towards administration.
1/4. Just an admin.
Roughly, yeah. Think about it. Every doctor's office, every hospital has to deal with dozens, maybe hundreds of different insurance plans, each with its own rules, its own forms, its own billing codes.
It sounds like a nightmare.
It's incredibly complex. Plus, you have proprietary IT systems that don't talk to each other easily. All this fragmentation adds massive overhead.
So how does that compare? You mentioned Canada and the UK earlier.
Well, in countries with nationalized systems like the UK's NHS or single-payer systems like Canada's, they have unified billing. It's much, much simpler.
Or of cost.
Their administrative overhead is estimated to be way lower, maybe in the range of like 1 to 3%.
1 to 3% versus 25%.
It's a staggering difference. That's money that, in theory, could be going towards actual patient care instead of paperwork.
Okay, so we have profit motives, crazy drug prices, massive administrative waste. What does this all mean for regular people?
Well, one of the most direct impacts is medical debt. Financial ruin, even.
Yeah, you hear stories all the time.
The report cites a figure. Over 100 million Americans have some kind of medical debt.
100 million. That's almost a third of the country.
It's pervasive. And here's a really critical point. Medical debt is the leading cause of personal bankruptcy in the United States.
The #1 reason people go bankrupt. Because they got sick.
Exactly. And that's something you don't really see in countries with universal systems like the NHS or in Canada or Australia. The idea of losing your house because you had cancer, it's almost unthinkable there.
That really puts it in perspective. It's not just an inconvenience, it's life-altering financial disaster.
Absolutely. And there's one more piece the report highlights. The lack of preventive incentives.
What do you mean by that?
The dominant model in the U.S. is still fee-for-service.
Right. Doctors get paid for each test, each procedure they do.
Correct. Which, logically encourages doing more things, more volume.
Not necessarily keeping people healthy so they don't need procedures.
Precisely. It's like paying a mechanic only when your car breaks down and paying them more the bigger the repair is. There's less financial incentive to do the routine maintenance that prevents the breakdown in the first place.
Well, it rewards treatment over prevention.
Largely, yes. Compare that to systems, say, in Australia or the UK, where there's a much stronger emphasis on primary care, the GP, the family doctor, and on public health campaigns, screenings, early interventions, trying to catch problems early or prevent them altogether.
Which probably saves money in the long run, too.
And leads to better health outcomes. It's a different philosophy.
So the report has this comparison table,
right,
laying it all out.
It does, yeah. It really crystallizes the differences. Let's just run through a few key comparisons they highlight.
Okay.
Universal coverage.
Yeah.
U.S., no. UK, Canada, Australia, yes.
Yeah.
Everyone's covered. Right. Percent of GDP on healthcare. U.S., around 17.3% back in 2023. UK, around 10.3%. Canada, 10.8%. Australia, 9.3%.
Still that huge spending gap.
Massive.
Yeah.
Out-of-pocket costs for patients, very high in the U.S., low to moderate in the others. Prescription drug prices, highest globally here. Negotiated down in the peer countries.
We covered that, yeah.
Medical debt, common, as we just discussed in the U.S., rare in the others.
A huge difference.
Life expectancy, 2023 figures, U.S., about 77.0 years.
Sure.
Peer countries, 81.5 to 83.0 years.
Still that 4-6-year gap.
And admin overhead. Estimated 8–10% in the U.S. system overall, though some estimates like the 25% figure apply to certain parts versus maybe 2–3% in the comparison countries.
Wow. Wow. Okay. So what does this all mean for you, the listener? I mean, when you stack those numbers up side by side,
Yeah.
it just paints such a clear picture, doesn't it? How radically different our system is, and maybe how much ground we're losing compared to places that get better results for their citizens.
It really does.
Which brings us back to that question. If it's not really working optimally for the average American, who is benefiting from this setup?
Right. And the report doesn't shy away from naming names, or at least naming industries.
Okay, who does it point to?
Well, first, the big insurance corporations, companies like United Health, Cigna, their annual revenues are in the hundreds of billions.
Huge numbers.
Then the pharmaceutical giants, Pfizer, Gilead, and others. We talked about their pricing power, especially here in the U.S. market, where it's less regulated than overseas. That translates to enormous profits.
Makes sense. Who else?
Large hospital conglomerates. They've been consolidating, buying up smaller hospitals, and their pricing can be, well, wildly inconsistent and sometimes seem predatory, depending on who's paying the bill.
You hear about the same procedure costing vastly different amounts at different hospitals or even in the same hospital.
Exactly.
Yeah.
And finally, the report mentions the medical device lobby, companies making things like pacemakers or artificial joints. They also benefit from certain tax advantages and how reimbursement is structured.
So a whole ecosystem of industries that are doing quite well financially under the current system?
Very well. And the report argues this isn't just happening passively. There's a political dimension.
Lobbying.
Huge amounts of it. These industries, insurance, pharma, hospitals, device makers, collectively spend tens of millions of dollars every year lobbying Congress and government agencies.
And what are they lobbying for? Or against?
Primarily, according to the report, they're lobbying to block reforms that could threaten their revenue streams.
Like what?
Things like a public option, a government-run insurance plan to compete with private ones, or allowing Medicare to negotiate all drug prices, or certainly anything resembling a single-payer system like in Canada.
So they're actively working to prevent major changes.
It's a very well-funded, very organized effort to maintain the system largely as it is.
But there have been attempts to change things, right? Like the ACA.
There have. The Affordable Care Act back in 2010 was a major piece of legislation. It did significantly reduce the number of uninsured Americans, which was a key goal.
Right, through the marketplaces and Medicaid expansion.
Exactly. But critics argue, and the report touches on this, it did so by essentially working with the private insurance industry, even subsidizing it. It didn't fundamentally challenge their central role.
It's sort of built upon the existing structure.
In many ways, yes. Then you have proposals like Medicare for All, which would be a much more fundamental shift towards a single-payer system.
That gets talked about a lot, especially in some political circles.
It does, and it has growing support, especially among progressives. But it faces immense opposition from the industries we just mentioned and significant political hurdles. It hasn't gotten close to passing Congress.
Any other reforms?
Well, the Inflation Reduction Act, passed in 2022, did take a small step. It allows Medicare to start negotiating prices for a very limited number of high-cost drugs.
Just a few drugs, though.
Yeah, it's a start, but it's far from the comprehensive negotiation seen in other countries. It's definitely not a systemic overhaul.
It seems like every attempt at major reform hits a wall of resistance, which raises a really important question. If the system has all these issues, and we know other countries do it differently and often get better results, what do Americans actually think about it? Is there an appetite for change?
That's a great question, and the public opinion data is pretty interesting.
Yeah, what does it show?
Consistently, over years of polling, a majority of Americans, often somewhere between 60 and 70%, say they support some form of universal health care coverage.
So most people want everyone covered.
The general principle is very popular. The debate, of course, is always about how to achieve it.
Right, the specifics get complicated.
They do. But there's also evidence of growing interest in alternative models outside the mainstream system. Things like healthcare cooperatives or direct primary care practices where you pay a flat monthly fee to your doctor.
Bypassing insurance for basic care?
Exactly. And some employers are even trying to bypass the big insurers, too, contracting directly with providers. People are looking for options.
And what about different age groups? Does that matter?
The report notes that younger demographics, millennials and Gen Z, tend to be more skeptical of the current system, and particularly of the motives of large insurance companies. They seem more open to bigger changes.
So there's definitely public support for the idea of universal care and maybe growing frustration with the status quo, especially among younger people.
It seems that way. Which brings us back to the report's overall conclusion.
Okay, how do they sum it all up?
Well, they say, it's easy to just call the U.S. system a failure. But maybe that's not quite the right word.
Oh, how so?
Perhaps a more accurate way to look at it, the report suggests, is that the system is actually succeeding. But for the people, it was really designed to serve.
Meaning the private corporations, the industries we talked about.
Precisely. From that perspective, it's working very well. It functions less like a system designed purely for public health and more like a highly profitable market.
With all the perverse incentives and entrenched interests that come with that.
Exactly. And that's why fundamental reform is so difficult.
So the contrast then with places like the UK, Australia, Canada, what does that tell us?
It tells us that achieving universal, affordable, equitable, high-quality healthcare isn't some impossible dream. It's not a fantasy.
It's possible because other countries are doing it.
They are. Which means, the report argues, it really comes down to being a political choice. Do we choose to structure our system, prioritize public health and access, or do we prioritize market dynamics and corporate profits?
And the report offers some ideas on how to make that choice differently. Recommendations.
It does. It lists several potential paths towards structural reform.
Like what?
First, some form of universal coverage mandate, whether that's achieved through a strong public option competing with private plans, or a move towards a full single-payer system. The goal is getting everyone in.
Okay, makes sense.
Second, implementing broad national drug price negotiation, using the government's purchasing power like other countries do.
Tackling those pharma costs.
Third, drastically simplifying billing and administration, cutting down on that massive overhead we discussed.
Getting rid of the bloat.
Fourth, shifting away from fee-for-service towards value-based care, paying doctors and hospitals based on keeping people healthy, based on outcomes, rather than just the volume of procedures they perform.
Aligning incentives with health, not just activity.
Right. And finally, and this might be crucial for enabling the others, they recommend political campaign finance reform to try and reduce the influence of industry lobbying money that currently blocks so many changes.
Addressing the political obstacles head on.
It's a comprehensive set of recommendations aimed at fundamentally restructuring the system.
It leaves you with a lot to think about. So maybe a final thought for our listeners.
Right.
Given everything we've just unpacked, this whole paradox, how do you view healthcare? Is it more of a fundamental human right, something everyone should have access to? Or is it more like a commodity, a service to be bought and sold in a marketplace?
It's a core philosophical question, isn't it?
It really is. And maybe following on that, how much do you think pure political will, or maybe the lack of it, shapes the kind of healthcare system a nation ends up with?
Something to definitely ponder.
What stands out to you from this deep dive today? We really hope this conversation has given you a clearer, maybe a more informed perspective on what is undoubtedly one of the most complex and critical systems in our society.